What we did during our experiences, we identified a case, we met the patient, which I think was a unique opportunity, and then over the course of a week, we started to define a clinical question that would, I think importantly, ultimately change the patient's management plan.
We sort of sit down and think, what are all of the questions that we have that's unique to this case? And in that setting, you set up different meetings with all of the experts in the field.
In thinking about this patient, Ellen and I got to meet with experts in the field of calciphylaxis to learn about what we currently know, but also about what holes exist in our understanding of the disease and how we could think about this patient and what risk factors she might have had and how we could study that to further our understanding of her presentation, but also calciphylaxis in general.
The patient that we were taking care of was a patient with cardiac disease, and we were able to speak with a number of cardiologists as well as experts pertaining to some of the more obscure aspects of his presentation, not just at Mass General, but around the country.
We were able to reach out to world's experts, basically at the NIH, at Mount Sinai, to run our experiments by them and see if they had any ideas in terms of what could be going on with this patient, and really, I think most importantly, how best to help the patient in terms of treatments.
So at the end of the 2 weeks, the group of residents, we put together a presentation in which we present to the Mass General community during a noon conference presentation. Anyone is able to come, and we present the case and then also some of the scientific findings that we may have been able to achieve during that 2 weeks, and then also things that we'd like to do in the future with this particular case.
The noon conference, I think, is a way for us to display all of our thought processes and really explain what we were thinking about how the patient got to where they were. What we ultimately also end up doing is we propose a series of experiments and hypotheses to hopefully come up with a way to help patients like that individual or other individuals down the road, either prevent their disease progression or maybe to treat them.
In principle, if the Pathways Consult Service were only an educational activity, yes, it would end with the noon conference. But we believe that there's more to be done. The hypotheses that are generated by the residents could be tested in collaboration with laboratories at MGH or elsewhere, and the data generated would allow us to then further the field, either from just a purely scientific perspective to understand more of the pathophysiology of that particular disease mechanism, or perhaps in rare cases generate data that would actually inform the clinical care that we might provide to patients such as the index patient that we studied.
One of the things that I've always done previously is, if you think this is a dermatology issue or if you think this is a kidney issue, you usually go to those specialists. And one thing I've definitely taken away from this particular experience is that addressing medical issues from many different specialties is better overall for the patient, but also to broaden your differential to think about a patient in many different ways was actually really helpful.
The synergy of 3 or 4 minds together thinking about one patient really makes a big difference in the long term. But on the Pathways elective, working with 6 to 10 different scientists in completely different fields and then really combining all of their expertise into this Pathways presentation at the end really showcased how important it is to discuss these problems sort of across the board with a ton of different experts.
So having done Pathways this year, I think has already made me more aware of patients who could potentially benefit from further investigation. And I've been able to identify patients whose presentations don't quite fit what we would expect, and have already started thinking more about what we could do to further our understanding of that patient's disease and also potentially affect their clinical care. And as someone who wants to be a physician scientist, I think that's a critical step in being able to work from the bedside to the bench and using our clinical examples to further our scientific knowledge.
Yeah, I think on a selfish note, the Pathways program has really tickled me in ways that I didn't expect it to. Before, I was definitely interested in gastroenterology, probably within the luminal section of GI. But now after this particular case, I've been sort of piqued by hepatology, and actually I'm entertaining becoming a hepatologist for the first time.